The following presentation will examine the inadequate nutrition among breastfeeding mothers during the COVID-19 pandemic. First, we will look at the importance of breastfeeding. Breast milk is a food source derived from the mother's breast, which provides many nutritional and immunological benefits for developing newborns and infants. It is specifically formulated to meet the child's nutritional needs, and it is also a safe and clean food source without risk of contamination compared to baby formula. The Academy of Nutrition and Dietetics adds that breast milk's unique antibodies help protect infants from numerous illnesses and diseases. This protection from disease promotes growth and survival. Infants who breastfeed are advantaged and will experience better health outcomes. And the Agency for Healthcare Research and Quality states that formula-fed babies are at a higher risk of developing diarrhea, ear infections, and other diseases. The decision to breastfeed is very much a personal decision. Here are some recommendations for breastfeeding. The World Health Organization and UNICEF recommend breastfeeding starting from the first hour of life and must be practiced exclusively for the first 6 months of life. Mothers who breastfeed should take care of themselves physically, mentally, and emotionally to produce enough milk for their baby. The Academy of Nutrition and Dietetics also mentions that breastfeeding mothers need plenty of nutrient-rich foods and plenty of fluids to maintain their stamina while producing milk, and that they should get enough rest. As mentioned previously, breastfeeding mothers need a nutrient-rich diet and plenty of fluids to produce milk. The nutritional needs are greater because of the mother's changing body. Breast milk is deficient in many micronutrients, and it is why it is recommended that women continue to take prenatal vitamins while they breastfeed. Some important nutrients are the following. Calcium helps production of breast milk. Vitamin D helps to produce good quality milk. Iron helps mother and baby prevent anemia. And omega-3s are good for newborn brain development. The protein intake is also recommended to increase by 21 grams per day for exclusively breastfeeding mothers. We'll take a look at some of the impacts of COVID-19 on nutrition. To begin with, we will look at some of the major setbacks experienced by pregnant and breastfeeding mothers. Access to health care was dramatically changed for this population. There was a difficulty in scheduling appointments for prenatal care due to the wait time. In some instances, women had to wait about months before they could schedule an appointment. There were also limits due to social distancing, where only one patient could be in the exam room. Labor and delivery at the hospital also changed due to COVID testing prior to delivery, and whether the result of the patient was positive, the baby was supposed to be quarantined immediately, limiting essential skin-to-skin contact with their babies. The challenges faced during pregnancy affected many mothers' mental states, pushing them towards depression due to lack of support systems. Some women can testify that during the pandemic, pregnancy can be traumatizing and lonely. For the women that experience depression during pregnancy and postpartum, this could present as a loss of appetite, which has a negative outcome on the health of her and the baby. The lack of appetite would mean there is a decreased caloric intake for the mother, which is detrimental for her ability to breastfeed. Another impact of COVID-19, and also mentioned in the Lancet Global Health Report, mentioned that there was a decreased access to food. This adds to the existing disparities among different locations and their access to healthy foods. At the beginning of the pandemic, news media created an increased fear, causing people to rush to their nearby grocery stores to purchase goods. As a result, there was a shortage of food items, leading to the placement of signage in grocery stores for consideration of the WIC population, pregnant and lactating women, infants, and children. In addition, the financial hardship struck many families because some were laid off or had their hours reduced at work. The reduction of monetary inflow also contributed to the decreased access to food. For some, a couple bucks were better spent on fast food versus healthy foods at the grocery store. Further issues with the COVID-19 pandemic included limited access to support groups, lactation consultants, and nutritionists because they could only be reached remotely via phone or video call. Some mothers would only receive one encounter with a lactation consultant following delivery for 1 to 2 hours. Nutrition education by dietitians at local health departments is also conducted virtually. The relationship between patient and provider changed drastically and possibly discouraged many from seeking the needed nutritional education. Now we will look further into one of these support groups called La Leche League International. This is an international nonprofit organization created in 1956 by 7 mothers of Franklin Park, Illinois. What started off as a local support group that held monthly meetings now has leaders in 81 countries assisting new parents with valuable information on breastfeeding and other topics. This organization is volunteer-led, and these volunteers are trained and accredited to hold the monthly meeting. The mission of La Leche League International is to help mothers worldwide to breastfeed through mother-to-mother support, encouragement, information, and education, and to promote a better understanding of breastfeeding as an important element in the healthy development of the baby and mother. The vision is to realize, deepen, and share the love and wisdom found in the breastfeeding relationship. The objectives of this organization are to help families by providing free meetings led by an experienced and accredited La Leche League leader, support populations of parents that want to breastfeed by informing them of the different stages of breastfeeding, and build relationships that allow families to interact with each other by being inclusive and diverse. An interview was held with North Fulton leader Carly Beers of La Leche League. Although she could not speak directly to the issue of inadequate nutrition among breastfeeding mothers, she did reference 2 articles in relation to food insecurity. The first article discussed how COVID-19 pandemic affected food system in the United States at the national level. Food insecurity due to elevated unemployment rates and loss of income drove needy families to food distribution centers. And while this article did mention school closures as a contributor to loss of income, Carly adds that at a local level, it does have an impact on breastfeeding families with more than one child because it increases food insecurity. For the low-income families, the pandemic created more strain on them, leading to disparities in maternal diets compared to those of higher socioeconomic status. An article reinforced this statement and is the second article that Carly noted, which highlighted the impacts of inadequate nutrition in low-income Hispanic families. It stated that when fathers are unemployed, families have fewer food choices and eat based on availability. In addition, the financial instability concerns breastfeeding mothers because the lack of vegetables in their diet and increased stress can diminish the quantity of breast milk or cause the milk to dry up. To help address the issue of inadequate nutrition, Carly cited La Leche League International's stance that it is important to eat a wide variety of foods in as close to their natural state as possible. She shared a website link titled Foods for Nursing Parents on La Leche League International's website with further information on this topic. She highlighted the fact that there are no foods to avoid unless a parent is allergic to them, and it is important to choose foods that will sustain and nourish the body. For women who are struggling financially and suffering from inadequate nutrition, the Supplemental Nutrition Program for Women, Infants, and Children, the Georgia WIC, is a good resource for these breastfeeding mothers. The program offers women different food packages for those who exclusively breastfeed or mostly breastfeed and supplement with formula. Additional information on this program can be found on the DPH WIC website. La Leche League International's success can be attributed to the serving of a diverse population of nursing parents. La Leche League International commits to serving everyone inclusive of race, ethnicity, religion, sex, national origin, ancestry, age, marital status, physical or mental ability, socioeconomic status, political views, gender identity, sexual orientation, family structure, or other protected status. It also attributes its success to the contribution of multiple generous donors. As we see in the diagram to the right, the organization received $219,490 from affiliates, area networks, and cost sharing, $199,895 in contributions, and $7,833 from meetings and special events. The organization also invests in leader accreditation and continuing education, spending at least $132,000 during 2019, which also adds to their success. Currently, none of Georgia's La Leche League support groups are offering in-person meetings. Because of the COVID-19 pandemic, they do have limited services, so they hold monthly virtual meetings instead of in-person meetings, and they use social media platforms such as Facebook to reach out their followers. Some leaders provide only contact information such as phone and email for additional support. Like any organization, La Leche League International has its strengths and weaknesses. Some of the strengths include the valuable information on their website with various topics such as breastfeeding, the diverse and inclusive nature of the organization, and that they encourage multiracial family relationships that share one thing in common: breastfeeding. Some weaknesses include that this organization is volunteer-based. The failure to answer phone and email harms the credibility of the agency and can influence whether a parent can easily access a support group in their location. The advice presented during the meetings can be biased, and in reference to nutrition, one culture may view certain foods as detrimental for breastfeeding, while others view the same food as beneficial. The issue of inadequate nutrition is not being addressed much within La Leche League groups. WIC helps to an extent, but only to those that are aware that it exists. Additionally, the PEBT program provided by the state governments as a source of food money for children helped many families with multiple children, which may or may not include pregnant and breastfeeding mothers. At the national level, not much is being done to address the nutritional needs of pregnant and breastfeeding mothers. Though the government has supplied federal stimulus checks for qualifying families to meet their basic needs, including food, some populations, such as immigrant mothers and the unemployed or stay-at-home moms that are considered dependents, may fall short of these benefits. Furthermore, the limited access to healthcare services during COVID-19 prevents a breastfeeding mother from having her familial and medical support to meet nutritional needs. The restrictions for healthcare visits do not contribute to the physical, emotional, or mental health of the pregnant, breastfeeding, and lactating mothers. Some gaps in delivery of services are existent among maternal socioeconomic and education levels. Families of lower socioeconomic status are more likely to suffer of financial and job instability, leading to poor nutrition. Families of higher socioeconomic status may have savings and higher education levels, which allow them to work from home and are less likely to have the same issue. Both groups seeking aid from resources may encounter long, tedious processes to receive their benefits. And geographical location also plays a role because people closer to healthy food stores may be more affluent and may not have the same nutrient deficiency compared to those living closer to the fast food joint. To fix some of these gaps in delivery of services, news, media, and radio should raise awareness of support groups such as La Leche League that can encourage breastfeeding women during the pandemic. In addition, word of mouth and increased use of social media platforms to promote these resources can aid breastfeeding mothers and will prove useful in reducing food insecurities.